Hello, my name is Avery Haller, and I have a master's in public health from Bastyr University. I am also a graduate of Holy Names Academy, which is the high school that these videos are being recorded for. But I do hope that other high schools take advantage of this resource, and I just wish everybody the best in this crazy time in our world. And I really appreciate everybody who is taking the measures to be socially distant right now, or another word we've been using is compassionate retreating. So I hope that you are safe and well wherever you are. So today I am here to talk to you about what public health is. This is going to be part of a video series in which I talk about what public health is, and then I'm going to talk more about COVID-19 specifically in the next video. And then in the final video, we're going to be talking about resilience strategies for ourselves on an individual level and also on a community level. But I just want to start out with what the heck is public health? Because you've probably been hearing a lot in the news from public health officials, and it's a little confusing who these public health officials are. So first things first, the difference between public health and healthcare. So in general, when we think of health or healthcare, we think of things like going to the doctor, getting vaccines, getting your shots. If you are sick, you are getting taken care of by the nurses or the doctors on call. Anything that has to do with, injuries or surgeries, that's usually what we think of when we think of the healthcare system. And that is all awesome. And there is a whole nother branch of the healthcare system called public health. So whereas hospitals and nurses and doctors are most of the time more concerned with the matter at hand, your acute illness, your disease that's already there, public health officials are concerned with preventing you from ever having that injury or that illness. So they do work on things like vaccines. They also work on things like making sure people have access to exercise and healthy habits, making sure people have access to nutrient-rich food, making sure that our roads are safe, and that we have seatbelt laws in place to make sure that people stay safe in cars, making sure that our alcohol and tobacco laws are really protecting vulnerable populations from becoming addicted to nicotine or alcohol. Also working on things like healthy air, healthy water, just making sure that our environment overall is clean, and that includes our social environment. So social isolation sometimes has negative health impacts. So we also want to make sure that communities are really well connected, which comes up a lot during this time. As we're dealing with this acute disease outbreak, we also want to make sure that people are socially taken care of, so that we don't have any negative mental health outcomes that come from this. So public health, once again, really focuses on our environment. How does our overall environment and life contribute to our health and our ability to stay healthy? So hospitals are focusing on the disease that's happening right now. Public health is focusing on kind of everything else. And public health tends to call the everything else the social determinants of health. So these are things, again, like your access to exercise. Do you have access to sports teams? Do you have access to the gym? Your access to education, because higher educational levels, like getting through college, tend to mean that people have a healthier life overall. Other things are, if you're an older person, do you have access to communities that can care for you in times like this? Do you have access to healthy gardens? And then also this deals with your experience of racism in society or sexism. So public health officials are very concerned about ending anything that has negative health impact on people, including racism, sexism, historical injustices. It has been shown that all these social determinants of health really do have an impact on our lives. So this is a graph from King County in Washington State. And if you are in another state watching this, you can find this information from either your county public health website or your state public health website. But this is from King County, where Seattle is. And as you can see, different people in different parts of the county have different life expectancies. This is called health disparities. We don't want health disparities. In public health, all lives are created equal. All lives have equal value. So we want everybody to have the same life expectancy, the same quality of life. We want all people to be safe and healthy. Another really, really important factor in public health work is monitoring disease. So for most of human history, disease has been a huge part of human life. And in order to make sure that we all have a long life expectancy, we need to be ready and able to conquer disease outbreaks such as COVID-19. So public health officials have procedures in place that help monitor the disease. So hospitals are reporting to public health officials when certain diseases start having an outbreak. And then they're also putting procedures in place to limit the spread of disease. And so that's when you start hearing public health officials say things like, please stay home, please wash your hands. These are all tools that we have to stop disease outbreaks. So we're getting towards the end of this video. And so I just wanted to give you some resources and some ideas of where to look for more public health information. So first of all, every county and state, and sometimes at the city level, we have public health organizations that in the US are typically government run, and many other countries are government run, but there are also non-governmental organizations that do public health work. So in the King County, Seattle area, you have King County Public Health. You also have the Washington State Department of Health. At a national level, you have the Centers for Disease and Control. That's the CDC. That is a great place to go for information about the COVID-19 outbreak in the US right now. And then you also have the Department of Health and Human Services, which is run by the federal government. And the CDC is also run by the federal government. Another place to go, especially during this current outbreak, is the WHO, the World Health Organization. So the World Health Organization does all this on an international level. So they are monitoring diseases on an international level. They are making sure that people stay healthy and well and avoid chronic disease on an international level. So the WHO is a really, really good place to go. So in conclusion, if you get in a car accident, the ER doctors and nurses are there to help you. If you want to prevent ever getting in a car accident, that's when you're going to head to the public health officials who are going to help you work on road safety with various stakeholders, various groups of people like politicians or engineers. And they're going to help make sure that the roads are so safe that nobody gets in a car accident in the first place. If someone that you know contracts coronavirus and has serious symptoms, then they will be headed to the hospital. And again, the ER doctors and nurses are going to do everything they can to treat that acute disease. The public health officials are out there asking people to stay home, wash their hands, limit any errands that you need to do to just the essential errands to ensure that fewer people get coronavirus in the first place. So that is all I have to say for today. In the next video, we are going to be talking about the COVID-19 outbreak more specifically and kind of delving into some of the issues around that. And there will be activities to do with that video and also this video. If you look at the bottom, there are some questions to answer. Thank you very much.